There have been a tremendous amount of changes in spine care in the 30-plus years I've been doing this.
You'll get a comprehensive physical exam. We'll target it toward things that we might be worried about.
It's really paramount that you understand what your patient needs to be able to help them in the most effective way.
That's something that makes our program special, is the multidisciplinary approach that we do offer right off the bat. Neck and back pain is a common complaint that we do see often. It's often caused by a variety of things, such as an aging spine, poor posture, not using proper body mechanics. Common pain sources that we see in clinic would include disc degeneration, disc protrusions or bulgings, spinal stenosis, arthritic changes, and even fractures. Reasons that a patient should seek medical attention or expertise would be when they're experiencing neck and back pain, but more when it's associated with arm or leg pain, numbness, and even weakness.
Yeah, I mean, the additional concerns would be people that have issues with bowel or bladder control or function. So the nerves obviously not only go to the arms and legs, but go to the bowels and bladder. So generally, if you have that, it's associated with some pain and weakness in the leg. So that combination, I think, is a red flag thing that says I need to get evaluated right away.
Sometimes neck problems can give you leg issues, and those can be even more onerous, and people should seek attention for that because sometimes it's not accompanied by any pain.
The spinal cord and brain have no pain fibers in them. So when you have compression of your cervical spinal cord, it really doesn't cause pain. And the classic description, which is really perfect, is numb, clumsy hands. So somebody who develops numb, clumsy hands, particularly when it affects both sides, and especially if it's related to problems with walking that you mentioned, even without pain, those are red flag things that say you need to come in and be evaluated.
And I think something that's really good with our program and our first appointment is we do provide a comprehensive evaluation. And I've had where somebody comes in reporting of low back pain, and lo and behold, upon further evaluation, they were actually showing some of the red flag signs that would indicate something more of a cervical myelopathy or cord compression.
The team approach is a holistic approach, and it's really paramount that you understand what your patient needs to be able to help them in the most effective way. We can refer between the providers, so if somebody starts with just needing physical therapy, and maybe then we realize that they may benefit from a spinal injection, say, we can get them to that appropriate provider rather quickly.
Yeah, I think that's something that makes our program special, is the multidisciplinary approach that we do offer right off the bat.
A lot of times just a plain x-ray is all we might need to go further with a diagnosis. Another test that we might need would be an MRI because it does look at soft tissue like spinal nerves, like discs themselves, which you can't really pick up on regular x-ray. They're also great to look at with a patient. And what's awesome when we come up with an MRI that actually matches a patient's symptoms, then we will feel much more confident in our diagnosis. After physical exam, after reviewing imaging, some possible treatment plans could be presented, and together the patient and the provider could make a decision on what the next step might be.
I don't think it's that common that other programs sit down, open up the image, and go through the anatomy and really show them. And I've had patients say, wow, thank you. That's the first time somebody's actually sat down and gone through this with me. And that in and of itself is a big satisfier.
The treatment plans are somewhat of a collaborative process with the patient. Some patients may have already tried therapy and don't want to go that route again, would like to have an injection or have, surgery sooner rather than later.
Well, and I think it also develops over the course of time. So the person that you see in therapy, maybe 90% of them are going to be better in 6 weeks and don't need anything, but the 10% that have trouble need to be reevaluated. And so you've gone forward with the simplest thing, but that hasn't worked, and so you then take the next steps. We are more than happy to look at patients that have had prior treatments and prior evaluation. We'll give them our honest, best opinion, and hopefully that's going to lead to a better situation. It's a progressive process. You try to get people by with the least that you can, and you go forward with the next thing.